A gastrostomy tube, or Gtube, allows nutrients, medication, and fluids to be inserted directly into the stomach. Your child may need a Gtube if they can't get enough nutrition by mouth or eat safely. A Gtube is placed by a laparoscopic surgery, which means placing a small camera, or scope, into the abdomen, as well as a small surgical tool. The abdomen is the space that contains our abdominal organs, like the stomach and the intestines, and is surrounded by the abdominal wall, which is made up of muscles, fat, and skin. The Gtube is placed through the abdominal wall, just below the ribs, and into the stomach. This is a minimally invasive procedure, which takes about an hour. First, your child will go to sleep under general anesthesia. In newborns and infants, a small incision, usually less than 1/2 of an inch, is made near the belly button to place the camera into the abdomen. A second incision is used to insert the surgical tool. Next, the stomach is gently brought close to the abdominal wall and secured in place with sutures. For older children, an extra camera, called an endoscope, is placed down the throat. This allows the surgeon to see inside the child's stomach and fill it with air, which pushes it against the abdominal wall. The stomach is then secured in place with sutures. In some situations, a T-fastener may be used. T-fasteners help pull the stomach against the abdominal wall using the T on one end and the suture lock on the other. These look like little buttons surrounding the Gtube, and several are often used. T-fasteners are not permanent, however, and are removed later. For all ages of children, the surgeon carefully makes a hole in the stomach, called a stoma, about the width of a pencil. Next, the Gtube is placed through the stoma and into the stomach. Depending on your situation, your child may receive a skin-level button or a long tube. The long tube can be replaced with a button at a later date. Finally, the Gtube is secured in place, the camera is removed, the incision is closed with sutures, and a bandage is placed over it. After surgery, your child will stay at Children's overnight. We will monitor your child and make sure the Gtube is working properly. Medication can usually be placed through the tube in the recovery room. Most children require either Tylenol or ibuprofen for 24 to 72 hours. The tube is ready to be used for feeds about 4 to 12 hours after surgery. If your child was allowed to eat by mouth before surgery, they can resume eating after this time. Before you leave, we will teach you how to use the Gtube and properly care for it. After going home, your child can do light activities like crawling and walking for the first week. After that time, most children can resume normal activities. Children can shower or sponge bathe 24 hours after surgery. They should not swim or soak the umbilical incision or the Gtube site for 10 days following surgery. The incisions usually heal in about 1 to 2 weeks. If your child received T-fasteners or other special sutures, they are usually removed within a week after surgery. To learn more, call us or visit our website by clicking the links below.